Good morning/afternoon, everyone. Welcome to our presentation on gaining a comprehensive understanding of intellectual disability. Today, we'll explore everything from its definition and diagnosis to the various intervention and support strategies available. I'm excited to take you through this important topic. Let's get started. Intellectual disability, which was previously referred to as mental retardation, is now understood as a neurodevelopmental disorder. It's characterized by significant challenges in intellectual functioning, like reasoning and problem solving, as well as difficulties with adaptive behavior, meaning everyday skills needed for social and practical life. If we look back in history, people with intellectual disabilities were often misunderstood and feared. Without proper knowledge, society tended to isolate and segregate them, which caused more harm than help. Today, the way we define intellectual disability has evolved. The focus is on impairments in reasoning, planning, and judgment that affect day-to-day social interactions and practical tasks, highlighting the real-world impact on individuals' lives. When it comes to assessing intellectual disability, it's essential to consider cultural, linguistic, and individual differences. This ensures the evaluations are fair and accurate, recognizing that each person's background can influence their performance. Overall, significant progress has been made over the past century. Our growing understanding and more compassionate support systems have helped improve the quality of life for those affected, reflecting a more informed and respectful approach. When we look back at the history of understanding intellectual disability, it's important to recognize the early efforts made by advocates like Dr. Samuel G. Howe. At a time when misconceptions and stigma were widespread, he emphasized the need for education and compassionate care. Then came a significant development with the introduction of IQ testing by Binet and Simon. This was a breakthrough because it provided a more objective way to measure intellectual functioning, which was crucial for diagnosis. Today, IQ tests are used alongside assessments of adaptive behavior, which look at how well a person manages daily life and practical skills. Together, these tools give us a clear picture of an individual's strengths and challenges. However, it's also essential to acknowledge a darker chapter in this history. During the early 20th century, the eugenics movement misapplied these concepts in harmful ways. This history serves as a powerful reminder of why we must always use these assessments ethically and with respect for the dignity and rights of each person. Ethical application is fundamental to ensuring that diagnosis and treatment support rather than harm individuals with intellectual disabilities. Let's take a closer look at 3 case examples to illustrate different experiences with intellectual disability. First, Matthew has a mild intellectual disability. He faces some delays in speech and social interactions, but it's encouraging that he continues to make developmental progress and participates in regular classrooms. This shows how inclusion and appropriate support can foster growth. Next, we have Vanessa, who has a moderate intellectual disability. She primarily communicates with short sentences and needs daily assistance. Despite these challenges, she has made strides in attending integrated schools and engaging in recreational activities. Her progress underscores the importance of consistent support and opportunities for social involvement. Finally, there's Dan, who has Down syndrome. His development follows a similar sequence to his typically developing brother, but at a slower pace. Dan's case brings up an important discussion: whether intellectual disability is best understood as a developmental delay or as a fundamentally different way of learning and processing information. This debate influences how we approach education and intervention strategies. These examples together help us appreciate the variety and complexity within intellectual disabilities. Here, we see the DSM-5 diagnostic criteria for intellectual disability, which are divided into 3 main parts. Criterion A focuses on deficits in intellectual functions. This includes difficulties with reasoning, problem-solving, planning, and other cognitive tasks. Essentially, it means that the individual's intellectual abilities are significantly below average. Next, Criterion B relates to adaptive functioning. This means the person has challenges with everyday skills that affect their independence and their ability to meet social expectations. These adaptive deficits can impact communication, self-care, and social interactions. Finally, Criterion C specifies that these issues must have started during the developmental period, which is before the age of 18. This helps distinguish intellectual disability from other cognitive impairments that might occur later in life. Together, these criteria ensure a comprehensive assessment of both intellectual and practical life skills, emphasizing early onset as a key factor. When we talk about intellectual disability, it's important to understand that severity can vary widely, from mild to profound. These levels are identified based on challenges in three key areas: conceptual skills, social skills, and practical adaptive skills. Starting with mild intellectual disability, individuals typically face some learning difficulties but can still manage many tasks independently. They might need occasional support but generally function with a fair amount of autonomy. Moving to moderate and severe levels, the needs become greater. People with moderate intellectual disability often require daily support and have more limited communication abilities. Those with severe intellectual disability need constant care and usually have very minimal speech, relying heavily on others for their well-being. At the most intense level, profound intellectual disability, individuals depend completely on caregivers for all aspects of daily living. Here, the focus during diagnosis has shifted away from just IQ scores. Instead, it emphasizes the level of support a person needs, which helps tailor intervention and assistance to their specific situation, ensuring they receive the right kind of help to improve their quality of life. Intellectual disability can result from a variety of causes, and it's important to recognize that no single factor is responsible. One of the main contributors are genetic disorders, such as Down syndrome and Fragile X syndrome. These conditions affect brain development and function, leading to challenges in cognitive abilities. Understanding these underlying causes helps us better support individuals with intellectual disabilities and tailor appropriate interventions. When we look at developmental outcomes for children with intellectual disabilities, it's important to understand that they often progress through the same developmental stages as other children, just at a slower pace. This slower progression means they may face particular challenges, especially in areas like language development, social skills, motivation, and behavior. These challenges can affect how they interact with others and engage with their surroundings, which is why tailored support and patience are crucial in helping them reach their potential. When children with intellectual disabilities face repeated failures and negative feedback, they can develop what's called learned helplessness. This means they start to believe they can't succeed, which significantly lowers their motivation to learn or try new things. Without the right support and encouragement, these children might set very low goals for themselves or give up quickly when challenges arise. That's why using positive, stimulating, and patient teaching methods is so important. Such approaches not only keep them focused, but also help increase their motivation and build persistence over time. Caregivers and educators hold a crucial responsibility here. Their supportive teaching styles can make all the difference in helping these children develop the confidence and determination they need to succeed. Ultimately, fostering motivation through encouragement is key to helping children with intellectual disabilities keep going, even when things get tough. When we talk about prevention strategies and prenatal care, education plays a crucial role. It's important to inform expectant parents about how to take care of themselves during pregnancy, especially by avoiding teratogens like alcohol, tobacco, and other harmful substances. These can have serious impacts on fetal development, so minimizing exposure is essential. Prenatal screening methods are another key component. Tools like ultrasounds and amniotic fluid testing help us detect genetic abnormalities, including conditions such as Down syndrome, early on. This allows for better planning and support. Promoting healthy maternal nutrition is equally important. Good nutrition during pregnancy supports proper fetal growth and development, reducing risks of complications. Lastly, public health initiatives offer culturally sensitive prenatal programs that help prepare families and address risk factors. These programs have a significant impact on lowering both the incidence and severity of intellectual disabilities, making a real difference in communities. Early intervention is crucial, and intensive education programs like the Carolina ABCDarian Project have shown significant long-term benefits in intellectual and academic outcomes for children who are at risk. Behavioral treatments play a key role by using reinforcement and shaping techniques to teach essential skills, such as language and self-care. Equally important is parental training. which helps caregivers apply these methods effectively to support skill development and manage challenging behaviors. Techniques like positive reinforcement and graduated guidance are especially helpful in fostering communication, social, and daily living skills in children with intellectual disabilities. All of these approaches work best when delivered in supportive, individualized settings tailored to each child's unique needs. Cognitive behavioral therapy, or CBT, is particularly helpful because it emphasizes building self-instructional and verbal self-regulation skills. This approach works well for children who have some language abilities since it helps them manage their thoughts and behaviors more effectively. Moving on, family-oriented approaches are equally important. These methods provide caregivers with training, counseling, and respite, which not only improves their ability to support the child, but also helps reduce the stress and burnout often experienced in caregiving roles. Lastly, parent training is a key component. It focuses on teaching strategies that are tailored specifically to the child's developmental stage and unique challenges. This underlines how crucial the family's involvement is in fostering the child's growth and well-being, from early childhood all the way into adulthood. Together, these approaches create a supportive environment that benefits both the child and the family as a whole. The inclusion movement in education is all about integrating children with intellectual disabilities into regular classrooms. This approach focuses on tailoring the curriculum to meet each child's unique needs and strengths, ensuring they can learn alongside their peers. One effective way to adapt the curriculum, especially for children with Down syndrome, is by using visual teaching methods, which often make learning more accessible and engaging. When family care or schooling isn't enough, residential and respite care play a crucial role by providing extra support. These care settings are not just about assistance. They also emphasize the importance of family involvement. When families stay connected and engaged, it helps strengthen emotional bonds and makes it easier for children to adapt to these environments. Ultimately, the goal of both education and care integration is to support the child's journey toward greater independence and a better quality of life. This often means helping them transition back to home or family-like settings whenever possible, so they can thrive in familiar surroundings while still receiving the support they need.